excited and honored to be able to present this to you today, and hope we can make our group proud.
Most definitely. Perfect. So we can go on to the next slide. So this here is our mission statement, to create a psychologically safe and racially inclusive environment. Perfect. We can go on to the next slide. So what is NSAC, you guys might ask? So the Nursing Student Advocacy Collective is a group of students that has come together in response to recent events that have transpired in the world related to anti-Black racism, police brutality, systemic oppression. We recognize that work needs to be done to enhance the diversity within the Dalhousie School of Nursing in terms of curriculum, leadership, and student body. For instance, there were previously designated seats for Black students, resulting in 100% increase in Black graduates. However, in 2013, these seats were removed. This then poses a question: why were these seats removed in the first place? And we can go on to the next slide. Thank you. So here, this is definitely just kind of like a general background of like kind of what drove us to, like, once we started like researching more about the topic, these are some of the things that we came to find. So overall, Black nurses are largely underrepresented and absent in the nursing profession. Additionally, this absence is evident within the Dalhousie nursing program in regarding leadership positions, the school curriculum, and in clinical practice. As a collective, we feel strongly that improvements must be made to the School of Nursing to create an inclusive and psychologically safe work and learning environment for all. We have taken notice of the severe lack of diversity and Black leadership within our teaching teams in the School of Nursing. There are very few BIPOC, so Black, Indigenous, and people of color, accepted into the School of Nursing each semester. The curriculums are taught are Eurocentric and therefore fail to address the signs and manifestations of illness on Black and brown skin. Finally, we also have accounts from Black students of microaggressions they have faced from SON faculty. This is unacceptable. So I would say experience is one of the greatest things that will definitely teach us. Personally, as firsthand experiencing what these microaggressions could be, when I was going through it, I was really wondering, did anyone else go through it? Because I was kind of feeling very much alone. Like when I was accepted into my program, I was one of the only Black students accepted. There was two. There's one, I'm fully Black, and the other student was half Black. And I actually didn't know the other student was Black until later on. I actually got to meet her, and she was like, "Yes, I'm Black." So when I was first introduced into the program, I was the only one, and I saw this was like, oh my gosh, I was like, this is an honor. We're going to represent the Black community. We're going to encourage more people to come in. And I just never really saw another person or had a lot of other people to like connect with and be like, are you feeling this pressure, or are you experiencing this? So hearing these Black experiences was definitely one of the greatest turning points, and when we heard these stories, it really made NSAC want to drive for like a better environment. So we asked current and former Black students for their experiences in the nursing program. It is not a coincidence that instances such as the following have been occurring among generations of Black nurses and nursing students. And we can go on.
And just to add on to what Miriam was saying, sort of how important these experiences are, and without even realizing it, we were almost conducting sort of preliminary qualitative data, if we think about it, seeking out experiences and extrapolating themes and ways to have solutions from these experiences, and also just thinking about the power of personal experiences and words. And just to do them justice, we picked out a few that I'll just read word to word. So the first one is, quote, "There was an instance in one of our professors in nursing school who everyone loved, but my memories of her are not the fondest because she accused me of cheating, even though I had not. It was very stressful. I had to go meet her in her office and she was going to report me to the dean of nursing for allegedly cheating on a pharmacology test. She said that I had to start sitting by myself and not with my other friends who were Black. And even when I started sitting by myself, I was still getting the same marks. There were people in the class who actually were cheating all the time, and they did not get singled out. But she saw 4 Black girls sitting together and assumed that they were copying off of each other. And so for the next one, quote, I can't think of any specific stories that stand out to me, and that is sadly justified by the fact that I've suppressed them. There were many times that I didn't belong in the classroom with their comments, and just simply the fact that 90% of the classroom and the teaching material itself is so whitewashed that it always screams, you don't belong here. And lastly, the lack of diversity, especially as it pertains to the representation for Black students in the Dalhousie nursing program, can be very daunting and feel unwelcoming for students of African descent. When there isn't proportional representation in your program or career path, it can feel like that isn't a place designed to make you succeed. I worried about my ability to enter the program, seeing how the population of Black students who have been accepted has been decreasing. In Yarmouth School of Nursing, there's even less diversity, and in my first year, I was the only Black student in my class. The only other Black student in the program was at the Halifax campus. We both applied to the Halifax campus together, yet were split among two universities. Having no one who looked like myself or that could relate to my ethnic background has been very alienating. We are taught that the importance of diversity in the field of nursing and the significance of having an adequate understanding as it pertains to the different needs of each culture represented in our population. Currently, that isn't truly being reflected in the students that are accepted into the program. I really want to see spaces in the program designated towards Black students and initiatives aimed towards their success, because I know it will have a positive impact on our career field. And so from that, we created a petition. And then Miriam can continue with what we did with that.
Okay, thank you, Viraji. So perfect. As we can see here, that kind of qualitative data, if every time I hear it, I get a little emotional, just because it just reminds me of what I was going through, and it makes me so upset to know that this was a current trend in so many students, especially coming from high school. I came from Halifax West, and it was very diverse. So I never once it was very diverse. The environment was healthy. I never once specifically encountered a teacher being racist towards me, or being in an environment that was blatantly trying to put down students for their skin color or their background or ethnicity, anything of the such. So entering the nursing program, it was such a kind of a big slap, very big learning point for me as a young Black woman into the realities of the world. I would say that the main reason that I came into nursing is I just loved the pillars of it, and I loved that it's surrounded about it wanted everyone, it embraced diversity, and it wanted us to make sure that we are aware of our biases, and we make sure we don't put that on people at all, regardless of their background, their sexuality, anything like that. So coming into nursing and seeing that that sometimes this wasn't upheld was definitely very striking for us. And these such qualitative data was the driving force that we were we need to do something. These are our friends. These are going to be our workmates. These are the people that are going to be, nurses are the ones that are going to be serving the community. It starts with us to making sure that at an institutional level, what we learn is that we are going to put out a healthy environment, and we are going to make sure that people are not going to be treated differently because of their background or anything like that. So we knew it started with us, and that's why we started this petition. So the petition, it was catered around Nursing Advocacy Collective goals. We asked for a set of things that we want to see changed within the curriculum that we'd to help these student experiences, so that they wouldn't occur again, because this is not a normal thing for a student to go through. We know this, the nursing program is very intense in itself, not to talk about adding on racial stress on top of that. So with our petition, we reached a goal of 1,000 signatures in 2 days. Our current number of signs was over 2,000. I'm sure by this time it's grown even more. Other people have come forward with their experiences. It demonstrates the need for and support of significant changes within the School of Nursing. So with this petition specifically, it really opened our eyes to just how significant this issue was in current day. I feel like back then, say back into like 2013, I was hearing more stories back then, but they kind of faded as time went. But it wasn't because the issue went away. It was because that people had suppressed them and they weren't speaking about it. So what we did is anonymously, we made a Google Docs and we allowed students to speak about their dealings with the School of Nursing and their experiences. And this opened up another whirlwind of information and qualitative data that we to use so that we could use for change and ask for our change. So here at the bottom, if you see, we have a couple people that started to speak up. I'll read one that says, there needs to be more diversity in the housing nursing program. The student population in the program remains predominantly white females. More representation is needed. Another one here says, I am one of only 2 Indigenous students in my class, and one of the 3 students of African descent. We need more in each class. Another one, I'm signing this because racism has always been a large but swept under the rug issue within Dalhousie University. By listening to these experiences of past, present nursing students who are Black, Indigenous, and of color, it is quite evident that there is not a lot of BIPOC representation. This, in turn, can create an isolating academic experience for those students. And that's just it. It created a very isolating academic experience for these students. And to add on, there seems to be more of a Eurocentric focus seen within the material taught in the nursing program. This creates gaps in knowledge needed for safe and competent care of future clients who are of color. Dalhousie University must do better to address these issues. And we can go to the next page. And here is just also more people speaking up. And you could tell, like, this issue is something that needed great light. And with this platform of us putting it on our Facebook page and making it public, that this is, I think a lot of us were suppressing what we were going through, and us finally taking a stand and putting out there, like, this is not right. I feel like it opened a space for everyone else to speak about these experiences, because it is not right. And it just shows just how much change is needed and how much these individuals are realizing that they deserve change as well. And we can go on to the next slide. Okay. So here is an example of the goals that we asked. One, it was to designate seats. The Dalhousie School of Nursing should designate seats for Black Indigenous students in admissions. The collective calls for 10 seats to be designated. And I would like to stress that with these designated seats, the idea was not just to let anyone come in just because you are of Black background. It was to make sure that the people that meet the academic standard, they have the marks, they have the ability, they have that. It was for them to get an equal chance to get into the program, because what we found out through more research is that many of the students, some Black students that actually did have the marks, weren't getting into the program. It wasn't that they didn't have it or anything, but they were being racially profiled, and they weren't. You have to check off like a box when you are like applying into the program. But it was quite a coincidence that a lot of these students that did make the PAR weren't getting in. So this was to ensure that these students are getting an equal chance. And I feel like 10 for Black and Indigenous students is just a bare minimum. We should push for way more diversity in it, because we are going to be dealing with such a diverse population that it's imperative that the people that are caring for them are diverse in itself. The second one, change the curriculum. The School of Nursing should include diverse content, including different races, ethnicities, cultures, and themes centered around each in healthcare. This is really very, very, very important. the population that we are going to be cared for is very diverse. If we don't learn about how different illnesses and manifestations can present in these different diverse populations, we would be doing a disservice to ourselves as even nurses, because we wouldn't have that information or know how. So I feel like it's very important to equip us with that information so that when we get out there, we can do our job the way that we know we should. Diversify leadership. So professors, clinical instructors, and guest lecturers should be hired from multiple ethnicities, races, and cultures. This is so important, especially like for a young Black woman like me. I'll say that when I was able to see another person of minority background take stand in like such a high position as a professor or anything, like I'll tell you, one of my role models that I looked up to throughout my whole nursing degree was Keisha Jeffries. I saw her on a poster and I was like, oh, a Black nurse, let me do that. I was like, I want to be that. I see someone that looks at like me that can do that. And I said, I'll put my energy and abilities to make sure that I can, the same way I was inspired by her, I hope I can inspire other people like that. So putting these diverse faces is in positions of higher power is just more than that. It's inspiring. It just shows it's giving like a huge path for other students to follow. And lastly, provide support. The School of Nursing should subsidize tuition of Black students in nursing. One thing that's really important here is in terms of support. Going into the program, the support that like I had, I didn't know of any other sports outside of like the nursing program. Like I only went to my professors, but sadly for me, not many of my dealings were good with my professors because some of them still carried these biased thoughts and stuff like that. So it felt kind of very suffocating because I thought like I couldn't go out. There was like other places outside the nursing program that I could ask for help, but I didn't think they would be able to do anything in terms of inside nursing. So providing support for these students is paramount because I feel like our experience, we should all have a great experience. And if with marginalized populations, they tend to have a way different experience than say white students. So for us to all come out of there as the intended, like how they want us to come out as nurses in terms of our mentality, everything, I feel like there needs to be to make sure that there's those supports in there to make sure that we come out in that way and equipped in the way a nursing student should be. And we can move on to the next one. And Varaji, you can go ahead.
So with our demands and proposals, a lot of this was informed by the experiences that we collected, and then also research that we've done ourselves. And what's interesting is that a lot of this research is actually from Dalhousie nursing graduate students, their research on Black student experiences, on Black nurses, on diversity, on Indigenous nurses and populations. And to go along with this, it's seen the advocacy work and the use of professional voice of graduate students like yourselves that became a real inspiration and goal for us. And as of yesterday, we've seen an email from the director of the School of Nursing acknowledging the issues going on in Sun and having a plan forward. And much of our goals are within that plan, and that's thanks to NSAC as well as the EDI and many other organizations that have been doing this groundwork for so long. And it's actually starting to get ahead, and we're starting to work on these changes. So I'll just briefly go through this. Miriam did a wonderful job at explaining the goals, but cultural competence and adequate representation, it's a value in nursing. And it's interesting that even though this is a value that's being taught to us, it's not something that the nursing program itself is exemplifying. And then secondly, given the diversity of our province, our country, as Miriam stated, our current curriculum is not reflecting that. It needs to be updated. We need to ensure that our communities are equipped with culturally competent healthcare professionals. We would love to see that every nurse, by the time they have graduated, have had a conversation with somebody of color, with an LGBTQ plus individual, with Black people, because these are the conversations that we will be having in our careers. And then on to the next slide, it is crucial to have Black nurses in leadership roles again to address the health disparities experienced by non-white communities. And lastly, we need to provide higher levels of educational attainment for Black students by counteracting systemic barriers and intergenerational wage gaps that are experienced by the Black population. So then on this slide on outreach programs and support programs, we recognize the need to have support, to also work with other Black organizations in the community in order to have a continuous implementation of protective and racially inclusive environment. It seems as though there's so many support organizations that Dalhousie has, but students aren't reaching out to them, and there seems to be a lack of a connected workforce. So if we could just bring together our common goals, we can better encourage enrollment, we can better support our students, and we can also support the unique issues of Black and Indigenous students. So now we'll go into discussion, and sort of the first question we'd like to propose is professionalism in terms of the nursing program. And how would you describe it? Or what was your experience when you first entered your graduate studies or in the undergraduate program? How did you view professionalism? I can't see anyone's screen, unfortunately, so if Miriam, if anyone raises their hand or would like to jump in, go for it.
Yes, I'm looking as well. And you guys, do not be shy. Here's an open space, and it's just great for these conversations to happen, because I feel like us being educated about it, we are able to spread that into different environments that we go into. And I feel like this kind of change and these kind of conversations, they need to happen among us so that we can spread that going forward. I feel like it's a type of environment and mentalities that we all need to have going forward. And yeah, I think these conversations are important. So don't be shy. Definitely speak out, and so we can have a good conversation about it.
Hi, my name is Jillian. Thank you so much, you guys, for this presentation. It's been really incredible and informative. And I'm joining you guys from Vancouver Island. I just arrived back home days ago for the holidays. I'm year 2, and I guess I'm advanced standing. I just moved to Yarmouth to join the nursing program there, and this has definitely been something on my mind, because I'm new to the area. I don't really know its going-ons very well, and I noticed only one person of color in my class, and I'm always we haven't been able to. We weren't in any groups together this year, so I haven't gotten to know them very well. But I'm half Asian, and it's definitely I've been wondering through my experience what their experience has been like, and so this has been really really interesting, and I could ramble on a bit for a while, but I'm a little bit nervous, and I just wanted to say thank you so much, and I'm really looking forward to seeing everything else that comes out of what you're doing.
Oh, thank you, and welcome, and thank you for speaking out. Yeah, definitely. I'd say in terms of, I like to say to you, how would you describe when you thought of nursing or coming in? Was there kind of a certain, when you thought of professionalism, how a nurse should be? Was there certain things that came to mind? I feel like there's some things that we were all attuned or on how to come in. I'd give an example. When first coming into nursing, in terms of being professional, something about hair, when you thought of like something, I wouldn't really think of braids. Like I have braids. I wouldn't think of that as professional, or it's not really sometimes accepted as professional. Kind of like straight hair, maybe professional, or sometimes you would think of a nurse, or the first vivid like thought of a nurse, of what a nurse maybe looked like. To me, well, I have people in my family that are Black that are nurses, but sometimes it might be a picture of a woman of Caucasian background or something like that. That's kind of like trying to see what was your first perception. Yeah.
Definitely, I feel like because growing up in Vancouver, I was actually one of maybe eight Asian kids in my school. Mm-hmm. It's a very, very white community where I grew up. And so people would say to me things like, Ching Chang Chong, what did I say in high school? And but I was born at the local hospital here. And so I hung out with the exchange students because they are the ones that like just treated me like me. But it's things that I never really thought of, because this is just I was born into this area, and it's something that I just feel like I was kind of used to. But I definitely have noticed my own assumptions, which are really interesting to realize, because there weren't, I feel like, if any, nurses of color in my community. And it's changing, thankfully, a lot here. Like even since coming back, like there's been a lot of influx of refugees and immigrants coming in, which has been pretty incredible. And I know, like, even within our class, we have somebody in Yarmouth. We have two guys in our class, and one is from Syria and one is from the Philippines. And like the what they're able to bring to the table in terms of new perspectives and ideas, and just from their personal experiences, it's really just so invaluable, because I don't know. I only have my own experience, and to have theirs is it's such an enriching experience. So I definitely know, like, when I think about professionalism, there have been assumptions on my end, which, it's, and I also do feel like I've noticed some inconsistencies in what we've been taught, which you touched on, which, like, inclusive, diversity, cultural competency, and some things, my instructors,
That's okay.
Have shared in class, where I kind of thought, oh, like, you're a really lovely person, but you totally don't know what's going, like, what you just said was kind of a bit strange, lack of a better word. But yeah, I don't know if that helps or adds at all, but
It did. And you just even saying that one thing that was for me is also just noticing what we thought was normal and what wasn't. Like that we were like, when I came, I thought it was normal for them to like say these certain insults to me or something, or call my braids snakes, or like, what's going on, Medusa, or like, it was just something that was normal to me. And then like, just like how you say you drew closer to like going to a community that treated you like you. So that just opens our eyes to see that, oh my gosh, we've set this standard that there was like normal for us to have, there for other diverse backgrounds to have these mini comments or certain things that were supposed to be normal to happen to us. But it's not normal. And I think that's what's so beautiful about this kind of change is we're starting to know that, oh, this standard that of professionalism, or what this standard is, was built on one standard. This standard was built on one standard, and the beauty of diversity is when all the diverse brains and ideas all those come together, that's the most powerful form, not one standard. So it's beautiful to see that we're all understanding that, oh my gosh, this standard needs to change for the better, because the amount of our differences coming together, it's what should form this new standard. There's not just one. So yeah, thank you for your answer. I understood exactly what you were talking about. So thank you so much. That was beautiful. That's perfect.
Thank you.
Moving on to the second question.
So
professionalism and racism.
Miriam, just before we move on, I see a person named that has the name Galaxy S9 just has their hand raised. So I just wanted them to invite them to join the conversation too.
Yes.
Yeah.
Hi, I'm a member of NSAC as well, and I'm heading to my first semester at the Yarmouth campus. I'm in Jillian's class, actually. And I was just thinking in terms of professionalism when it came to the idea of hair, because I'm a Black student. I worried about that same thing going into like my first day of clinical integration. I was worried that like a prof would say something about my braids not being packed up neatly enough, and I was really worried about getting into it. I feel like the idea of professionalism that we have isn't reflective of Black or brown people, and it's very like Eurocentric. So that's
very. Thank you, Tommy. Thank you. Because these are so, and I feel like one of the most important things is that we're all individually, down to everyone, is starting to realize that this standard is BOGO. This standard is BOGO. And it's so important that you can see with these conversations and the people that join in these conversations, we can see that we all have a common denominator of knowing that the standard is wrong. And with that, we can change it. We can definitely change it. It was built one way and we can build it another. Definitely. I'll show one experience. I remember on my last clinical, I had braids in, and then I went to put them up. And I went to put them up, and I don't know why the nurse was looking at, one of my coworkers was looking at me so weird, and they're like, "So what goes on with your hair there," or something like that. Is it and I was answering these questions, and I was like, okay, and stuff like that. And then I finally was trying to put my hair up because my braids were long. I was trying to put my hair up, and the nurse said to me, "I don't think it's appropriate to do that here." And I was like, "Wait, what?" I was behind the nursing desk, and you could just tell that she maybe had a standard of maybe my hair wasn't accepted, more professional or something like that. And because we've already been having these, and by that time I'd already been having these NSAC conversations, and us all realizing that, oh my gosh, these people are trying to put on their one-way standard on us. By that time, as soon as the comment, it didn't hurt me as much anymore. I was realizing, oh shoot, she is not even aware of her biases. So it starts with us making sure that we understand that, yes, the way we wear our hair is professional. It is also professional. It's braids, it's neat, it's a way that we express ourselves, and that is absolutely fine. So thank you so much for sharing that, because that's another standard that we need to change. Hair does not show your professionalism or standard or anything like that. So thank you. Okay, and I'm just going to look as well. If anyone else has something to say as well, I'm looking at my screen for hands up, but you guys just jump right in, open space, and you guys go right in as well. Professionalism and racism. So the next question that we had is, these kind of flow into one another. So I'll ask it, and if someone has an opinion on it, you go ahead, speak on any of the three. So is the standard of professionalism inclusive? Kind of touched on that. Is there room for diversity and professionalism in terms of nursing? How do the standards of professionalism enforced by the program affect student experience?
I might set off, Miriam.
Oh, yes.
For me, I felt like professionalism, in one way, is to ensure that we represent nursing in an ethical and responsible way. But just the way nursing was formed, it's formed from white upper class women, and I feel as though professionalism is almost based off of that. and there isn't room for expression outside of the realm of whiteness. And it's very microaggressional, the pressure I feel about professionalism. It's hair and outside and appearance as well, but also just the manner and the way I speak, the way that I act. I feel like it's almost an assimilation quality, I feel, going into the nursing program, that we all must end up the same. Whereas if there was more encouragement of diversity and differences, I think having unique nurses from different backgrounds, if that was celebrated more, it would be a more safe space for students.
Exactly. I love that. You pinpointed it exactly that. I see something from Nadine that says, I don't have the option of raising my hand. I'd like to make an entry. Oh, Nadine, you go right ahead.
Thank you, Marianne, and thank you, everybody. That's actually very interesting. And as in my role as a faculty and being earlier a student at Dell, I definitely am being an immigrant, right? So I struggle a lot with lots of concepts, but so I kind of compare the concept of professionalism with something I struggle with, which is being inclusive in my teaching methods. The concept itself stands. Professionalism by itself stands. It applies for all professions. It's being professional. It's looking like and practicing your communication, your presentation, your knowledge based on what the profession should or what the profession incorporates, right? It is basically how to be accepting of the diverse people we have. That is the subject of discussion, I think, which is not the term itself. The term itself stands by its own. It is what incorporates, like, is an individual behavior of somebody talking about your hair. That, to me, their approach is not professional because they don't understand the idea behind having the hair done in a certain way. It has to do with infection control. It has to do with, like, there's a rationale. That's my understanding when I teach my students. Rationale about certain things. If they are prejudiced, if they have stereotypes which are kind of negative in this sense, that gives them this way of reaching a student that does not represent what they have in mind. That's individual behavior. I'm not undermining it. It's quite there. It's very harmful. It's very hurtful. It is quite common. I'm not saying it's not. Kind of putting it out there that, like, if we want to reach somewhere and get something to be done, we can't say we want to reject the term professionalism. We're going to say, let's look into how this professionalism is operationalized, it's being implemented in real practice, and point these things to see where we can give more context to these items that are grouped under professionalism. I struggle, as I said, myself with inclusive learning because I believed in the individuality of each student. And it's like, can we address each nurse or each nursing student individually and look at them individually as professionals to consider them professionalism? So what I'm calling for is, because as I see, that's a very interesting work, honestly. So it's just like putting goals for these terms that are doable and probably fragmenting down into 2 or 3 items that you want to include, one of which would have to work with the appearance, because obviously it's the black color in this context, or anyway, different color that kind of triggers people some people to kind of behave in a certain way. So that's my entry for professionalism. And I think I'll wait for the discussion because I want some insight into some of the points that you talked about, which I'm eager to hear what you have to say about. Like, I need help from you.
Yes. We love that. Okay. Thank you for your entry. And I think it's important. I loved that you were like, yes, we want to do better, and you were saying that you struggle with how we could do that. Which is great because, again, understanding from different point of views is how we get that. And it's so good to see that you're like, oh, I noticed something that we can do better, or something that we want to do better, and that's how we're taking a stance on it. So that's perfect. I think there's even another question that starts to go in there and answer. Another point to speak on what you were saying is I loved how you said professionalism was or a standard was set so that that we act in accordance to a way that was professional and the way that we present ourselves as nurses. And yes, I think that it's not necessarily those standards were put in place for certain reasons, and it's just making sure that people don't manipulate or use those reasons to put down other people or things like that. So it's making sure that standard upholds to its true value and what they were put in place for, because I feel like it's those certain standards that right now are kind of like affecting students and allowing certain people to take advantage or so of different minority groups. So yeah, I love that you're speaking on making sure that those standards actually do meet why they were set, in place. Oh. And then here.
Hi, can I make a comment?
Yes, go ahead. We would love you to.
Hi, I'm Danielle. I'm one of the. I'm in master's studies. I graduated from Dalhousie a few years ago, not that long. I wish there's something that I wish I had learned in undergrad, which is kind of goes along with the question that you have on the screen. It's very possible to get some racialized comments from the patients and how to react to comments. I don't think I learned that in school. So, and I don't think I mastered that skill yet. But I think that I think the students also need to not only to be inclusive in within the nursing professions, but also know how to act professionally when we encounter racialized comments, and we can take that opportunity, turn it into a learning opportunity to change the norm. Yes. So maybe that's something that we need to include in the new curriculum, how to react professionally when we receive racialized comments from patients or colleagues. Instead of building the tension, how can we take that as an opportunity to change and teach others?
Yes, I 1000% agree with you. I love that you brought that out, because that's another thing that I say it's important for it to be in the curriculum, because it's something that we're going to encounter in our everyday lives as a part of that will be in the profession, in our in the nursing profession. So that is definitely something I feel like with our pillar of being diverse, and we have a strong value surrounded by that, for us to act accordingly under the standard and make sure that we can still uphold that, it would be definitely imperative. I feel like that's of course imperative for us to make sure that we know how to deal with that in a professional way, a way that also doesn't come down on us and affect us. Because when things we have to remember, when things affect us, it will also affect the way we give care or affect how we carry our day and stuff like that. So it would be definitely important to make sure that we receive that kind of training as in the group. I think that's even something that Viraji, I would, and all the nursing advocacy students, and we should definitely bring that to light to the board. It's very important, because that's something we're going to encounter every single day. Definitely. Thank you so much for your input. I think that's definitely something very important that we should learn and we should know, especially where we have such a strong value around diversity. To uphold that, we should know how to deal with that, and it's just one of the pushes towards this new change of healthy environment that we're looking for. So thank you so much. Does
So
anyone
maybe
else
we can
have,
go on.
because I see this.
I made an entry because I can't raise my hand.
Yes.
Me to put I can share personal experience with patients if that.
Yes, I would love that. We would love that.
So honestly, I'll start as a faculty in my role as a faculty. As a student, honestly, I didn't have lots of resources. I didn't know how to do it. Not to say I did not interpret certain situations as being racially injustice. I did find myself questioning if something was racially just. But I was more focused on studying, honestly. I didn't dwell on it. Now in my role as a faculty, actually, I learned using the buzzwords EDI, and whenever I'm kind of advocating for any student because of their diversity, not only racially, for whatever reason, I use this word EDI, inclusivity, and obviously it resonates. When I say this, I see whoever was resisting kind of stance, observing, or gives me time, or gives my attempts to do something with this student, give me the space to do whatever I'm doing. And honestly, they haven't disappointed me, these students. Every student I advocated for because they're diverse and provided support for, and I should probably keep record of numbers of them. They are doing extremely well. So that really tells that some support for these students, not a lot. I'm not going to say that I'm working a lot with them, just some support. Sometimes just validating their experience is enough. Now, when it comes to my experience as a nurse in Canada, it was extremely interesting. I started working as a bedside in Canada, which was like 3-4 years ago, in a nursing home. And the level of racism, I would say, among these elderly is kind of high because it has been part of their, it's been for some time. And honestly, I had one patient, one resident, she looked at me and she said, "You have dark eyes, you don't know what you're doing." And then she started all the time walking around and saying, she doesn't trust me, she doesn't like me, I don't know what I'm doing, I'm not a nurse, I'm claiming to be a nurse. Honestly, I did not take that personal. That's first thing. To me, the horror she was living with me giving her medications and she not trusting me with her medications, I think that's more suffering for her than it was for me being told these words, honestly. Now, at one point, I had to confront her because it was a big thing and she was affecting all the residents. I said, "You don't have to like me. I have my credentials very well, but we need to cooperate to give you your medications." And to be honest, when I could handle this to another staff, I would, because of yes, I acknowledged that she was really terrified. And now there's another resident there also who used to make fun of me and says, "I don't know how to speak English. And if I don't know how to speak English, this means I don't know how to treat him." And then at the same time, he was honestly scolding me. I was still cleaning his mouth. He was saying these words and he was spilling on himself and I was cleaning him. And that by itself was an occasion for him to stop. And then he apologized for me. And these are elderly. You can imagine what their cases are. In acute care, people are more eloquent, I would say. They would engage in a discussion, a conversation about my culture, about things, but then they would always ask, "So are you good enough? Do you know what you're doing?" In different terminology. And then I had to spell out my credentials for them so that, okay, now we trust you. So it's going to take a time to change the culture for the people to get convinced that coming from a different race or coming from a different background, we do have the credentials at hand and that they are safe with us. So it's how we brand ourselves, probably, how we present ourselves professionally with the adequate information, how we approach our patients, showing them that we know what we're doing. It can build some trust in they trusting us. But the first thing I would advise, don't take things personal. So that's what I wanted to say.
Thank you so much, Nadine. Thank you. And to quickly add on to that, I would say with my personal experience and throughout my 3 years, first when I was experiencing, mine was with faculty. So which was very, very hard for me because the faculty is the main ones that I thought I would be able to go to express these things, and I wanted them to do something. So it was so hard to see that those were the same people that were actually kind of doing it back to me. So it's I felt kind of stuck. I say that the first thing that was so important is, one, don't hold it in. I think that one thing that was important for me is I explained situations to my friends, my closest friend, and also people that if I had another Black friend or something, I spoke to them about whatever I was going through. It's important for you to realize and understand that you need to know your worth and know that these comments we are not, like Nadine said, we're not going to take it personal because we understand our values. So it's very much making sure that we understand that we know that we belong there. We are well enough educated to be there, or else we wouldn't have gone into the program. And then, so it's based on, some people say comments just to specifically hurt you just because. And it's not necessarily on your for real worth ethic or how you carry yourself. They just have some type of bias or something that they've carried, especially with this elderly population. So one thing I would say is to make sure that we understand our value and knowing that we deserve to be there. We understand why we're there, and holding that and taking that to address situations in a respectful manner that still abides by your value of you knowing yourself, and then also speaking out. With mine, I was scared to speak up, but once I spoke, my friends, and I told them, they're like, this is not right. And all of NSAC was so supportive, and we were collectively able to stand together and bring this towards the board. If this maybe I know that some people are scared to do that because one person speaking out on something, you don't know if you'll be penalized for it, will you be looked down on it? I would say yes. One, understand your value. Two, know that you deserve change, and speak to someone because they may have another resource out that can help you, connect you to someone that does know how to deal with these issues and stuff like that. That was one thing that was very important. And in this question, it says, as faculty and graduate students, when you recognize racial injustice, how do we address the issue? That's so important. Just thinking that, one, we understand that this is wrong behavior, and two, understanding our value that we know ourselves. We're not going to try to allow this to mentally affect us or things like that because we understand our value. And three, making sure we reach out to a resource that can help us through this, because I feel like support was one of my biggest things, that we all understood that this was wrong behavior or whatever I was going through, and we all took a stance to make sure that we reported it. NSAC, I would say if you within school, for students that are still in school, if you experience something like Nadine, you said that you didn't have a lot of maybe supports or you didn't know who to go to. Now a group like NSAC that's in there, NSAC is an advocacy group, so we help you speak. It's not just your single voice, it's now your voice plus this collective voice. So making these supports available to these students is going to be paramount. So just knowing that for these students that are in school now, that there will be supports like NSAC, so that it's not just your voice, there's a collective voice around that. I think, I don't know if that helps answer your question, but I feel like one thing is making sure that they have the supports to be able to speak out so we can make these correct changes. And our group, as graduate students and as faculty, kind of in EDI, it's working together so we make sure that these occurrences and stuff don't happen too often. And when they happen, how do we learn and grow from the situation, and how do we make sure we are able to handle it or equipped to handle it?
thank you, Miriam, so much for that response, and thank you, Nadine. I personally liked your stance in this person was suffering more. So to think of it in a way of compassion for the other person, that's something that I think I'll try to think about going forward. And just to conclude, because I know we're going a little over time, our last questions may be something we can think about while we end this session. What steps at the faculty level, but I'd like to add even on our each individual level, can we implement to contribute to this change? And how can we extend this beyond undergraduate studies, beyond graduate studies, beyond our jobs, and in our personal lives? So that's just something to think about as we go on with our lives. But I'd just like to thank Brianna for helping organizing this, everyone who came to attend. This was a very wonderful conversation to listen to and hear each other. So thank you very much.
Yeah, thank you guys.
Thank you both for presenting. This was an incredible conversation. I wish we had another hour. I feel like we could get some more discussion going, but perhaps maybe sometime next semester we can have you back again and just check in and open up and see what other initiatives and kind of where we've gotten to in 2021. I think that would be really helpful. But endless thanks for presenting. It was wonderful.
Yeah, thank you. If I may say, I'm gonna pose my question because it resonates for the rest. I'm really struggling with connecting with the students of color. In this sense, I reach out for students, and eventually I have people who end up talking about their struggles that I can support them. I have had the chance to meet with a couple of Black students that I know they are struggling evident in their grades, but they still refuse to talk about what they're going through. I mean, struggling in the sense of how can I help them study? I'm not talking about their personal life. Like, where is your gaps here to help you? And they deny. They say that we're good, we'll manage. This means that they don't feel safe enough. To me, that means they don't feel safe enough to ask for guidance, or probably are reluctant to open up and talk about this. So how can we, through your advocacy group, kind of find a liaison where these students, feel that, okay, we can reach? And I'm going to be honest,